Ladies and gentlemen, today I'd like to speak to you about a little known illness known as Meniere's disease. I didn't know about it until my mother was diagnosed. So I'm going to tell you a little bit about what it's all about, what are the effects, and how can it be treated. Meniere's disease is an anomaly which could cause strong disease spells, tinnitus, and a loss of hearing, amongst other things. The sickness generally only affects one ear. Something very typical of this disease are vertigo episodes, dizzy episodes that happen suddenly or that happen after a patient has had pain in their ear. Now, these vertigo episodes, or some are more frequent and others less. Some people suffer such strong vertigo attacks that they can't even stand on their own feet. So I could see how you're probably asking yourself, what exactly causes these attacks? And it's thought that it's an accumulation of liquid in the part of the ear, the inner ear, which is known as the labyrinth. This is where the organs that control balance and hearing are found. So this part of the ear contains lymphatic liquid, and it gets compressed and it affects these cells that are known as sensory cells. And the sensory cells have to do with how we feel. And these cells, when they're stimulated, send signals to the brain. And the people who suffer from Meniere's disease or this accumulation of liquid interferes with these signals and that go to the brain, including the hearing signals. And that, in a nutshell, is what produces vertigo or the other symptoms of this disease. Now, up until now, it's not exactly clear why this accumulation of liquid happens. Many believe that Meniere's disease might be related to a vascular or blood vessel issue in the same way that a migraine is. And then there are other experts who say that it could be a manifestation of allergies or some other health issue. So what the most important question often is there a cure? And unfortunately, I think I have bad news for you. There is no cure for Meniere's. There's only medications to alleviate the symptoms. There are drugs that lower the dizziness caused by the vertigo. So this medication can be taken in pill form, but if the vertigo episode is so strong, they could be administered an injection in order to halt the episode as soon as possible. In short, somebody who's been diagnosed with Meniere's disease can lead a normal life, provided that they take their medications consistently and they avoid moving their head very abruptly. One abrupt movement can really cause a lot of dizziness for somebody. The other thing that could really affect people is a sudden change in pressure, like what you would feel if you're going into a tunnel or a plane taking off. So I'm not really sure that at this point a cure can be found. However, I do hope that the medications continue to work and prevent some of the symptoms so that people like my mother don't have to suffer so many vertigo attacks. Thank you for your attention.
para curar esta enfermedad.